The Public Servants Association in KwaZulu-Natal is picketing outside the Prince Mshiyeni Hospital in Umlazi, south of Durban today. They want to sound the alarm on the impact caused by poor water supplies at the facility. The hospital is now in its second week without proper water. The health department is blaming the eThekwini Municipality, saying it's the city's responsibility to ensure water supplies. Newzroom Afrika's Phila Mthembu is at the hospital, joins us now. Phila, good morning to you. I've never worked in a hospital, but we all know you need proper water, working water at a hospital. What are people saying there?
Absolutely, Stephen. I mean, you can imagine that something as huge as a hospital needs water to conduct day-to-day operations. And without water, unfortunately, it becomes a catastrophic environment. So that is why there is this picket over here. We understand that, the reason why there is a shortage of water and also in areas around here in Umlazi is because of the insufficient amount of water which is available, and also, aging infrastructure. So we're going to bring in now, as you can see, there are different unions picketing outside the hospital. There's Denosa, there's also the PSA. I'm going to bring in the PSA's Mlungisi Ndlovu to speak to us and give us a sense of how hectic the situation is. Thank you so much for your time. Mlu, if you could first tell us the reasons why you are picketing outside here and how hectic is the situation in there.
The reason we are here, it's because the management has failed us. They have 2 weeks to share the contingency plan. They are not telling the truth to say there's a contingency plan. How do you operate a hospital without water? We have indicated to them back in 2023 to say they must have reservoir and attend to these issues of water cut. In ICU, aircons are not safe, are not working. Telephones here are not working. Unemployed, there is doctors, shortage of doctors, nurses, and everyone. So that's why we said the MEC and also the Prima must intervene. This hospital accommodates over 500,000. We believe that the management has really failed us. People must see us in the media. We have started engagement. We have signed a letter to the acting HOD, Mrs. Penny Dlata, to say we need intervention. So she has not responded to us. As PSA, we're not going to be silenced. There's a shortage of medication in some of the clinics, even in hospital. When we tell about these things, we are not politics. Ours is not to tell lies. Ours to tell truth. That's why we are here, PSA is here, other unions are here with the same voice to say we are tired. We are tired. If they need to change the leadership, they must change the leadership. If they are anti-workers, what needs to happen? People are dying in the hospital. I'm not saying if it's their time, it's their time, but we must be able to act urgently. If the minister is listening, eThekwini Municipality, where is your plan? Where is your plan to supply the hospital? We are asking the mayor of eThekwini. There are no water tank here. What is the problem? Why you can't supply the people of this hospital? And also Umlazi. Umlazi, you always have a problem of water, and the community must stand up, because as PSA, we are not playing in the political garage. We're telling the truth. These people are understaffed. They are expected to go and fetch water. A professional nurse fetching water, and the control of these waters that are distributed in hospital. There is no infection control. This is a hospital. You're not sure whether these water are clean. Where is Human Rights Commission? Where is Public Protector? Where are these state entities to be able to respond?
And I also know that this is not the first time water has run out of this hospital, correct?
Yes, it's not the first time, because when we engage with the management, they are saying it is eThekwini Metro. We only know one government in our province, which is led by the Prima Tool. They are MECs. So if you've got a problem at the district level, you must engage with higher level. 2023, we're here. 2024, people complain. 2025, do they understand the meaning of contingency plan? We're not talking about ordinary contingency plan. Contingency plan is saying when there is water crisis, we know we've got our reservoir to supply us. Where is a water crisis? There are water tanks that can supply us. Supply clean water. So in actual fact, the OHS allow members to refuse to work in an unsafe environment. We are saying a Department of Employment and Labour must come here. They've got all right to refuse to work in an unsafe environment. So we are saying the Nursing Council must respond. They abuse our members here. They deduct unauthorized deductions. They ill-treat them. This is like a prisoner. Even in prison, it's much better. As PSA, we can't be silenced.
All right, thank you so much for your time. Stephen, that's where we leave it. Quite a number of concerns and also allegations coming out of that conversation. The issue of the sufficiency of medication at hospitals has also been brought into the spotlight, as well as the mistreatment of the medical staff. We have been told by the PSA that it's one of the things which have been happening in this particular hospital, and that this is not the first time water has gone out from the hospital, Stephen, which is a great concern for them.
Phila, Mthembu, thank you very much indeed for that update. The water situation in Umlazi at that hospital there.